Hello, welcome to our town hall focused on planning for spring 2021 at Johns Hopkins University. I'm Lainie Rutkow, a professor in the Bloomberg School of Public Health and senior advisor to Johns Hopkins President Ron Daniels. I serve as one of the team members leading our 2021 planning efforts. I'll be the moderator for today's session, and I'm joined by 4 of my university colleagues who lead our 2021 planning work. Today, I'm here with Stephen Gange, Executive Vice Provost for Academic Affairs and a professor in the Bloomberg School of Public Health. Stephen will be speaking about academic planning. We're also joined by Jon Links, Vice Provost and Chief Compliance and Risk Officer and professor in the Bloomberg School of Public Health. Jon will speak about measures being taken to mitigate the health effects of the pandemic in the Johns Hopkins community. Jane Schlegel, Vice President and Chief Administrative Officer, will speak about operational planning. And finally, Andrew Douglas, Vice Provost for Faculty Affairs and Professor at the Whiting School of Engineering, will discuss representation of faculty in the planning process, as well as impacts of the pandemic on faculty productivity. Within the next few days, a message regarding finances will be shared from university leadership as well as your divisions, and that is not the focus of today's discussion. We'll have the following goals for this town hall. First, to provide insight into our current planning efforts for the spring and key considerations informing our decisions. And second, to answer your questions about the spring planning process. Before I turn things over to our panelists, I want to note that we all understand this is an extraordinary time with much upheaval and uncertainty due to the COVID-19 pandemic. And we are all deeply grateful for the commitment of the faculty to students, patients, and colleagues. And with that, I'll turn things over to Stephen Gange.
Great. Thank you, Lainie, and thank you all for participating in today's town hall, either now in real time or asynchronously. I think it's fair to start by acknowledging that the situation that we're in right now is far from anyone's first choice. We all wish we were back at campus in person, whether it's in the classroom, the laboratory, and gathered with our, having social interactions with our peers and our students. Let me start by saying a few words about fall. We really appreciate how much work faculty are doing to deliver a high quality fall experience while we're in a largely online remote modality. We've received positive responses from students in the recent survey that we did reflecting all of this hard work. We received over 10,000 student responses in our survey, with response rate ranging from over a third of the master's students to nearly half of the undergraduate students. There was strong agreement from the students that they're able to pursue their learning goals through online instruction and didn't have, on the whole, significant problems participating in this modality. What was really heartening was to see the strong agreement, even stronger agreement, that faculty were willing to connect with students outside of class time as needed. 95% of the undergraduate students agreed with that, and 96% of the graduate students agreed with that. The concerns that were expressed by the students were not surprisingly around connectedness. Over half of our undergraduate students and about 40% of our graduate students disagreed that they felt part of a connected community of students. The detailed results of these surveys were shared with the deans and vice deans last week, and I would encourage you to contact them for more information. Over the last several months, we've been working centrally to complement the work that's being done divisionally to support instruction. Back in June, university administration asked divisions to submit proposals for co-investments to support remote and online instruction. We've contributed over $4 million of central money for projects that include modifying over 120 state-of-the-art studios and enhanced instructional spaces for faculty to conduct remote instruction in a way that promotes interaction with students. We've invested in other technology to help help instructors, studios in the box, headsets and mics, webcams to help those who are teaching from home. We've supported training and support of student assistants and provided funding for additional technologies such as Blackboard Ally, a program to help with accessibility for online materials. We've also been helping to ensure that the questions and needs of faculty and students are being addressed with new or modified policies. We've distributed Zoom recording policies to help you navigate the trickiness with regard to Zoom recordings as FERPA protected items. We've helped faculty understand the IP policies on instructional materials, as well as negotiating the changing and thorny issues with regard to international student visa issues. Research has also been operating, really successfully as per the return to research guidelines that were put out by Denny Wirtz, Vice Provost for Research, and his team. Proposal submissions are up from 2019. In the last 2 months, we've climbed from last year 1175 up to 1,300 new proposals, submitting over $1.1 billion in external support in August and September. The new sponsors awards are also up from 545 last year to 615 this year, and we've received over $31 million in COVID funding to date. So while, this fall, this summer, while we recognize community transmission of COVID is still occurring here in Maryland, we have seen an improvement in the public health situation here in Maryland over the summer and the early fall. After the rise in cases between July and August, new cases have been relatively stable since the beginning of September, although we're of course watching the metrics carefully as cold weather sets in. The populations that are more vulnerable are being better protected, greater therapeutic options are becoming more widespread, and hospitalization and death outcomes due to COVID have been low and steady over the last several months. And while public health strategies are continually needed to further lower the rate of community transmission, we believe the stable public health situation and our operational readiness provide an opportunity for us to start planning for additional activities on campus incrementally. And that brings us to our planning for spring. We are watching and learning from how we are doing, and we're watching and learning how our peers are doing, many of whom have demonstrated success in de-densifying their campuses while still bringing students and faculty back in person. In short, as good a job as everyone is doing, we have been challenged by senior leadership not just to accept the status quo and to explore all options for the resumption of in-person activities, classes, research, and additional work in spring. We've done a lot of preparation. We put out and were prepared before deciding to move to an online modality for fall, the return of students this past semester. We put out a series of campus guidelines that have been socialized and had great feedback from across the community. We have very strong working groups and advisory groups that include faculty through the University Pandemic Academic Advisory Committee, students through our Students Advisory Committee, and our Health Advisory Group with leaders from medicine and health and public health. We're working on modifications that we may be able to do now. Many labs have asked for us to lower the density to allow for more individuals to be in laboratory environments, and that is something that we're working on. Many faculty have also expressed interest in returning to their offices as well as expanding their access to the library. And we're working on a proposal that would be in conjunction with facilities managers and divisional business officers to allow for this expansion in a safe and measured fashion. Academically, each school is preparing its academic plan and no decisions have yet been made. Your input and thoughts on this are very ripe to help us shape what spring will look like. As we're preparing to bring students back to campus, we want to do it in a way that's consistent with our principles. So what does this mean? First, we'll always keep health and safety first. We're continuing to monitor the trajectory of COVID as we enter the winter months. And looking not only what happens locally, but where our students are currently, as well as what is happening in other settings. And we'll continue to consult with our health advisory board to inform all of our decisions with health and safety in mind. We're working for campus preparedness. We don't want capacity and operational constraints to limit how we prepare for spring. And you'll hear in a little bit from Jane and Jon about some of the preparations that we're doing and expanding some of our essential elements that we've initiated for fall. We also want to continue to maintain optionality for faculty and students. We know that not every student will be able to make it back, and some will choose not to get back, and we want to provide options for those who can't participate in person. And we also want to find pathways for faculty who don't want to put themselves in a face-to-face setting. And that is done in very many different ways across our different schools. And lastly, we're working to coordinate some decisions university-wide, but I would say that there is probably greater heterogeneity now than there was for planning for fall in terms of how we're approaching spring. We're in conversations with the dean's offices in each of the schools to talk about what makes sense pedagogically from their standpoint, as well as the resources they have with faculty and physical resources as well. So all of those will help us make decisions together. And again, your input on this, whether it's through our town hall, through questions that you want to ask, or through your dean's office, are greatly welcome. Let me just close by initial remarks by saying, these town halls are an opportunity to try to get feedback. We held a town hall with undergraduates and their families last week. Just last night, we had a meeting with department chairs from all departments across the university, and we have an additional town hall with graduate students tomorrow that we'll continue to use to share what we can, as well as to hear concerns and feedback on our plan. So with that, Lainie, I'll turn things back to you.
Thanks so much, Stephen. I want to take a moment to remind everyone, please submit any questions that you have in the Q&A box, which is just under the video player that you're currently watching. And now let's go over to Jon Links.
Hi, everyone. Good afternoon. I want to start by reminding everyone that we have a 4-phase plan for resumption of activities on campus. Phase 0 is stay at home. Phase 1 is the phase we're in now. It's a low density phase. Phase 2, a medium density phase, is what we're planning for in the spring. I'll come back to that in a moment. And then at some point, phase 3, a return to normal, or our new normal, but a high density, a normal density operating posture. What moves us from phase to phase, and honestly, that's both forwards and backwards, which we hope doesn't happen, is the public health conditions, both present conditions and the trajectory of conditions and modeling and forecasts of conditions over a semester. And so we're paying very close attention to those metrics and working closely with our health advisory group. What we're doing right now is planning as though we'll be in phase 2 for the spring. We think we'll be in phase 2. We certainly hope we'll be in phase 2, but we won't know for certain until we get much closer to January and to the end of January, when we enter spring semester, to know for certain what the conditions are and what operating posture, what phase we will actually be in. But everything you're going to hear about in terms of our planning is directed at a phase 2 expansion from the current phase 1 low density operating posture. As has been the case all along, from a public health control perspective, we count on 4 primary measures, what I call the 4 pillars: masking, distancing, hygiene, and room ventilation. And those will continue to be very critical in controlling on-campus transmission in the spring. To those control measures, we will be adding mass testing, greatly expanded from where it is now. So you'll recall that in past town halls and other communications, we've described the 3 uses of testing: medical management, epidemiologic surveillance, and public health management. We're actually doing all 3 now. So everyone with symptoms, students, staff, faculty, university, and health system, are tested, as is anyone who is living with someone with COVID. That's for medical management. It's part of our Johns Hopkins COVID call center process. That process is a unified process between the university and the health system, and it's also unified for students and employees. And by unified, I mean both university and health system personnel physically staff that call center in a common physical location, and all operations arise out of that call center, from the initial intake to referral for testing, the actual testing, return of results, case management, an interview to see what other Hopkins close contacts you might have, a notification of those contacts, et cetera, all of that in a unified way. That will continue in the spring, obviously with more people on campus, as we hope. The number of personnel in that call center will expand, but the operations will be as they are today. So we're doing lots of testing for medical management. We also have an epidemiologic surveillance study ongoing right now at Homewood with several hundred students, staff, and faculty. In addition, there is mandatory testing of all students in our dorms right now. So they are asymptomatic, and that twice weekly testing is the foreshadowing of the much larger mass testing we intend to roll out for the spring in concert with our Johns Hopkins Medicine colleagues. What we're thinking right now is that mass testing will be mandatory for all undergraduates twice weekly, and will be available for anyone else on campus: graduate students, staff, and faculty. We're talking through the details now with the deans and vice deans, but that's the gist of it. There'll be lots more testing of asymptomatic persons than there is right now. In addition, the dorms will be opening up beyond the hardship cases that are currently in the dorms, and as a result, the isolation and quarantine rooms that we've set aside will also expand to match that additional number of residents. So we're working through isolation and quarantine right now as well. And with that, I'll turn it back to you, Lainie.
Thanks, Jon. Okay, now I'll turn things over to Jane Schlegel.
Good afternoon, everybody, and thank you for your time. I'm just following up on Stephen and Jon. We are in full planning mode for a return to a spring return to campus phase 2. And so there is lots of a large team that is working around that testing that Jon just outlined for that phase 2. What I want to highlight today is walk you through really quickly about the Prodensity app and do an overview, a little bit about flu shots and compliance and how we're going to manage compliance and enforcement. So there is a Prodensity app that if you come on campus, you will get asked 2 questions. One is about whether you have symptoms, and the second one is if you've been in contact with anybody in the last 14 days that's had COVID. And based on those questions, if you answer no to both, you get a green pass. If you answer red, you are then asked to call the JHCC Center, which will walk you through an algorithm once you contact them as to whether they need further testing for COVID. What we're doing right now is what I consider a passive compliance check. We have safety ambassadors that are in various buildings that have research going on, and we will expand that. We also have safety ambassadors across the Homewood campus outside, asking folks to make sure that they are have face coverings, socially distancing, and also checking on those apps when they interact. And so that is what I consider more of a passive. What we want to do going forward, and lots of people got this email just the other day, we sent out a reminder email that if you are on campus or have been on campus at least once, there was a reminder email to say, please fill out that Prudensity app, or what we call the COVID health check. And so we are trying to make sure that emails going forward are encouraging, getting folks to use that app. And then come November, we really want to start to look at reports that will do what is a cross-reference between your access to either Wi-Fi or through a J-card access, and whether you filled out the app. And so those reports will be able to start having us find folks and remind them specifically to make sure that they fill out the app. And eventually we will start to send those reports out to either supervisors, or in the faculty's case, it will go to Andrew Douglas, and we will send them out division-wise. We really need to, as we work through the fall, to work towards spring to have folks compliant by using that app. So also with that, there is the flu shot. Everybody has seen, I imagine, there's an email that went out to make sure to encourage everybody to get their flu shot. It is required to come back on campus. It is very easy. You can get it through the health center, Walgreens. A number of us have already done it. It's very easy to upload. When you go to the Walgreens, they have access, and there's a database that we are keeping. And what will happen going forward is we will start cross-referencing that database with the app, and be able to basically signify to you that if you have not gotten your flu shot, to please do so. It is a requirement as you come back on campus to have that. And then the other thing that we're going to be doing is from a flu shot and monitoring and reports, we will also be looking at that in terms of who's gotten their flu shot and who hasn't, and making sure that we reach out, not just through the app, but again, through supervisors and appropriate deans of faculty that are in each of the divisions, to make sure that we're finding out those that are on campus, whether they have their flu shot or not. The safety ambassadors will also be, again, looking for those pro-density red or green. And so we are going to expand the amount of safety ambassadors we have as we go towards spring. We are thinking through having on the Homewood campus for January, we will make sure that we have J-card for at least one entrance and exit to each building on the Homewood campus, so that we can make sure that we can monitor those compliance. And we are expanding the safety ambassadors to have many more roaming around, and maybe actually have some at the doors to make sure that folks have that green app to be on campus. And then the last thing I want to just mention is we are working through, again, as Jon said, the whole testing. We are looking at expanding that testing on multiple places. The Homewood campus will have multiple sites to be able to get tested. We will have testing sites at EB, the East Baltimore campus, Cary, SICE, depending on who is going to have folks on campus. So we are looking at making sure that it is convenient for anybody that comes back to get tested and have that available. With that, I'll turn it back to Lainie.
Thanks a lot, Jane. And now I'll go to our final speaker for today, Andrew Douglas.
So Thank you very much, Lainie, and welcome to everyone. Good afternoon. Let me just be brief about things so that we can get to as many questions from you as possible. I do want to remind you of just two things. Firstly, the extent to which faculty are being represented as we plan for the spring. So the real representation comes through the schools, but there's also faculty-wide representation through the Faculty Budget Advisory Committee, which meets more frequently now and is consulted more closely at the very highest levels of the university planning effort. As you know, the university also stood up a University Pandemic Academic Advisory Committee to deal with the pandemic early in that planning process. And that UPAC plays a major role in pandemic decision-making. And then, of course, we rely very heavily on Hopkins expertise, which is also relied on by our peer institutions. And that is the Health Advisory Group, which provides a completely independent expert guidance on just exactly where the pandemic is and how our planning should take into account where the pandemic is and how it's progressing. So there's strong faculty representation, and we continue to keep communicating with the faculty, and that's part of what we're doing now. The second is to let the faculty know that we, throughout the institution, really do understand the impact on faculty that the pandemic is having, particularly on the productivity that the faculty can still achieve. And we know that this impact is not uniform at all, but highly dependent on discipline and on family circumstances. And you know that there are certainly a number of articles in serious journals and in the Chronicle of Higher Education on how women are being disproportionately affected and how people with primary childcare are being disproportionately affected. So that's something that we're trying to mitigate as much as possible. And those mitigation efforts range from help with childcare to changing the timing on promotion decisions. And we're working very hard with all of the faculty groups who make those decisions. Finally, just let me say that I want to back up Jane's comments about the use of pro-density. And that is going to be an important part of the mitigation strategy going forward. So with that, I think it's time for us to deal with questions. Lainie, up to you.
Thanks very much, Andrew. And I want to thank everyone who's watching and submitting questions. I'm going to shift over to your questions right now. Okay, Jon, I'm going to send this first one over to you. And this concerns what operations and campus services will look like during phase 2. So can you please speak generally about that?
Certainly. So a little while ago, I said that there are 4 operating phases, 0, 1, 2, and 3. We're currently in phase 1. We want to be in phase 2 for the spring. You can think of phase 1 as low density, phase 2 as medium density, and phase 3 or return to normal as high density. So right now, we've been making what I call recalibrations and others call adjustments or refinements, even within phase 1. So we started with a required very low density in the labs, 400 square foot per person. We moved that to 200 square foot per person. So in a sense, having the density requirement, and we're about to move it to 150 square feet per person, all within phase 1. We also did some very modest opening up of offices that were associated with the labs and some modest opening up of the library for research purposes. Here's my point. Even in a low density setting, as we see how things are going, we adjust on the fly within a phase based on public health conditions, based on, frankly, community behavior on campus and other considerations. The same would be true in phase 2. So we're not going to launch into phase 2 as though it's normal times. Phase 2 was never designed to be high density normal times. It was designed to be medium density. The fact that we will add in-person instruction to what we're doing now is by itself a move to medium density. The other services, buildings, activities we open up will be taken step by step during the spring semester as we see how things are going. And that includes things like expansion of the library, expansion of the rec center, and so on. So don't assume that the way we describe the phase 2 operating posture when we announce what we think spring will look like, don't assume it's etched in stone that no further adjustments or refinements will be made to that. If things are going well, there will be incremental opening up during the spring in exactly the same way there's been incremental opening up now. Having said that, the main difference between where we are now and where we are in the spring is going to be in-class instruction, other on-campus academic activities, and residential students.
Thanks, Jon. As long as you're speaking about phase 2, I have a follow-up that just came in. Is there any chance that phase 2 would include bringing non-affiliates back to campus for events or meetings?
So I think we're all really sympathetic with that question. There are a lot of research activities, a lot of other scholarly activities that involve colleagues from elsewhere, as well as other types of co-curricular activities. I think at the beginning, we're going to play it cautiously, frankly. Non-affiliates are not our primary focus. Getting affiliates back onto campus in a safe and effective way is going to be our focus. So I don't think right now we're prepared to say, you're going to hold a conference with 50 people, go ahead. I think we're not at all prepared to say that, to be blunt about it. But as we see how things are going, we, like you, are anxious within the constraints of phase 2, and of course, within the constraints of the state and the city's operating posture at the time, to open up as much as we can.
Thanks, Jon. I'm going to shift gears for a few questions that we've received about testing, and I'm going to stick with you on these, Jon. So first is it possible for testing to be expanded to those who are only suspected of having been exposed?
So let me talk about where we are now, where we're going to be in the spring, and then something in between. So where we are now is that in routine, testing is only available via medical management to those with one or more COVID symptoms and those who don't have symptoms who are living with someone who's been diagnosed with COVID. Of course, I've already said we have a several hundred person surveillance study of asymptomatics in addition to that, and all dorm residents right now are being tested twice weekly. In the spring, I said that at a minimum, all undergraduates will be tested twice weekly in a mandatory fashion, and testing will be available to anyone else. So a graduate student, a staff member, a faculty member who themselves want to get tested, it'll be available in the spring, and you won't need to have a story. You're just going to show up and get tested. So what about between now and the spring? And we are considering expanding the routine use of testing between now and the spring, and it'll be with a particular focus on those entering quarantine, which by definition are those who are suspected of a meaningful exposure. So stay tuned for that.
Thanks, Jon. And an additional question for you related to testing. Other universities that have mass testing programs have reported issues due to lack of compliance among those who have tested positive. What are we learning from that for our planning?
Well, I'm going to talk about those who have tested positive and those who have tested negative, because we're concerned about both. So those who test positive are supposed to go into isolation. Obviously, at this point in our low density operating posture, we can very much control what happens on campus. In fact, we've only had one residential student requiring isolation. But we know that there are students and others who test positive and are off campus in terms of where they live, but also off campus, they're not coming onto campus right now, who are not necessarily honoring isolation. And we're about to beef up communications around that. We are equally concerned about those who test negative, because for many people, testing negative feels like a get out of jail free card, when of course it's not. It just means you're not meaningfully shedding virus right now. It doesn't mean actually that you're not infected per se. And it certainly doesn't mean that you're not going to get infected when you go out to a large gathering to celebrate your negative test. So we are definitely increasing messaging. We will also, of course, be increasing surveillance and enforcement in the spring with more people on campus. So it'll be many more who fall under our testing program. And it'll be many more who fall under the other elements of our control measures, masking, distancing, and so on. In addition, the ProDensity app that Jane spoke about, so a daily health check is mandatory for anyone on campus. And on campus doesn't just mean Homewood, it means any of our campuses. And that will be another way to track the health of our community.
Thanks very much, Jon. I'm going to turn now, Jane, to you with a question about the ProDensity app. When you said that it applies to those coming to campus, does that mean the hospital, including ambulatory centers, or just Homewood?
No, as Jon just stated, it applies to all campuses and all buildings. So the East Baltimore campus, ambulatory centers, all will have it, and have had it actually for a while, because the clinical settings have been using it since early in time, May or June. And so it is all, not just Homewood.
Thanks, Jane. And Jane, additional question for you. Can you speak a bit about the JH Needs You campaign, as well as the survey that's out right now?
Sure. So there's a team that is working on a campaign that is literally called JH Needs You. There are signs all over campus, both Homewood and the East Baltimore and other buildings, that folks are utilizing. The signs are highlight the 4 key things about the social masking, the distancing, hand washing, and making sure that if there's compliance issues, that you call out the Speaks to Us line. And so we are we've rolled that campaign out, but we are in the throes of refreshing that, thinking through other ways to communicate and get more signage and communication out about it. So happy to take any kind of ideas and thoughts. But we do interact with faculty, staff, and students for ideas, and get together pretty regularly with that larger group. We meet weekly, but again, we're looking to refresh that campaign and expand it going forward into the spring. There is a survey that Jon and I sent out, I think it was just yesterday, that went out to the community. It's really important that everybody answers those questions, because it will be really key data for us to be able to drive and pivot on where our campaign is going, and what areas that we might be missing that need to get more communications around. So really appreciate everybody's input on that campaign. John, I don't know if you have anything else you want to add to that?
That's
Maybe
great,
not.
Jane. I'm fine. Thanks.
Okay.
Great, thank you. Stephen, question for you. And this is keeping in mind faculty who have young children at home, especially young children that are now at home and taking their own classes remotely. What options will be given to faculty in the spring relative to teaching remotely?
So as Andrew mentioned, the issue of trying to work at home for many families is a very tough situation, and I think the deans are highly aware of the concerns of faculty around these lines. Certainly all of the decisions about teaching expectations and responsibilities is a local decision. There's no broad decisions that are managed by the university around something like that. But what we did in preparation for this fall was to put processes in place for both accommodations and adjustments to schedules that would allow faculty to, if they had specific, let's say, health concerns, work through our accommodations process to make sure that they are appropriately addressed, but also work with HR on an adjustments process. And so that is a way for faculty who have specific concerns, whether it's small children or whether it's living with older parents, to work with their division and their local HR staff to come up with appropriate adjustments. So that would be the primary step that faculty should take for modifying their schedule.
Thanks, Stephen. John, question for you. What's the planning for contact tracing? And could you please speak about it in the context of what happens, say, for those who might be teaching an in-person course and someone in the class has tested positive?
So our contact tracing, like everyone else's, is predicated on a close contact, a meaningful contact as defined by the CDC, which, as you know by now, is being within 6 feet for 15 minutes or more, and that's masked or unmasked. I know that for many of you, that feels like a pretty high bar before it's close contact, and that contacts that are of less duration than 15 minutes, you think should count as meaningful contacts, and you're worried about it. And you're worried about contacts for a longer duration that are at greater than 6 feet. Frankly speaking, we have no intention of changing our definition of a close contact right now. And we have no intention of doing notifications beyond close contacts. That just adds unnecessary confusion without, we believe, improving medical or public health management. The control measures I've spoken about, not only during this town hall, but lots of times, masking, distancing, hygiene, and room ventilation. I want to focus for a second on the and room ventilation. So we all know by now, and my primary appointments in environmental health and engineering, we've known for decades that aerosols come in a variety of sizes, and depending on the size, stay airborne or settle out more rapidly over a shorter distance. And so the initial focus with COVID on large respiratory droplets that settle out within 6 feet was an appropriate focus, but it shouldn't have been the only focus. And for us, it wasn't the only focus. And some of you have heard me talk before about the moves we made to HVAC systems in classrooms throughout the university. We have, in essence, maxed out the air exchanges in all classrooms throughout the university. We have upgraded filters that needed upgrading in the systems throughout the university. And we are running those HVAC systems even now before those classrooms are occupied 24/7. Whereas in the past, of course, evenings and weekends, to save energy and save money, we would turn things down. So if you're worried about a contact for more than 15 minutes and at a distance for less than 15 minutes and or at a distance greater than 6 feet, the answer isn't to redefine what a close contact is. The answer is to make sure that the control measures are suitable to maintain the appropriate definition of a close contact as within 6 feet for 15 minutes or more. And with the masking, the distancing, that is the low density in the classrooms, and what we've done with the HVAC systems, we think it remains an entirely appropriate definition for a close contact. We, of course, think the same thing for labs, where the air exchange has always been very, very good, and where the 6 feet, the masking, and the overall lab density guidelines are in play.
Thanks, Jon. I'm going to pivot now to several questions that have come in about students. And Stephen, this first one is for you. Can you please speak about the ongoing planning for international students and what that may mean for coming back to campus?
Sure. I would point as a source first, Jim Brailer and the Office of International Services that really serve as the experts for navigating the university's decisions and guidance around international students. This is, to not minimize at all, a very tricky area. It is a changing area. It is one that, as we have seen over the last several months, there has been issuance of guidance that have sometimes reversed. And I would say that currently the guidance that is out for spring is not crystal clear. So we've certainly been operating in accordance with the regulations and guidance that is out there. And some of the key points are having to do with having students being allowed to be here for academic activities. Students historically, before all of COVID, could not come to the US on a visa for an entirely online program. I think is not a surprise to anyone. But over the course of COVID, there's been a recognition that, like us, this fall, we had to, because of our public health considerations, pivot to be fully online. And we were granted permission, universities were granted permission that would allow continuing students to continue to have visa status even in that environment. We are assuming that that set of conditions will remain for spring. It is not certain, and we are monitoring carefully what the guidance is coming out. So the good news is that that guidance does give us flexibility. If we are able to, or I should say need to, stay in a fully online posture, either because the public health situation demands it, or we have to pivot to that. Under the current guidance, students would continue to have visa status. What each of the schools, as I mentioned at the top of the town hall, are doing is putting their academic plans together. They are taking into account the fact that based on the pedagogy, many things may not be best delivered in an online modality, but also aspects of international student experience. If some students need to be here, they are evaluating their ability to provide in-person activities. We've certainly interpreted, and this is long-standing, for certain student types that there's an expectation that they would be doing in-person activities to begin with. Doctoral students, for example, have a variety of activities outside of just their pure classroom and instruction. So they historically have been granted permission for staying here in the US. But again, we're looking to, based on what the current guidance is now, expecting that, again, if we bring people back for in-person campus activities, that would meet the guidance and they would be allowed to do that. If we need to pivot to or remain in a fully online modality, our current, the current guidance is that it would allow continuing students to stay. I recognize that that's a complicated answer, but it is a complicated situation, and we are trying to navigate and provide guidance to students and faculty who are bringing students back.
Thanks, Stephen. And a follow-up to that, if we do bring back certain groups of students, will classes still be offered online for those who either do not wish to or cannot return?
Yeah. So we again, as I said at the top of the hour, we are trying to continue with our optionality for faculty and students. We recognize some students won't be able to come here. International students may have continued travel restrictions. Students get sick. Students don't want to come for an in-person experience. And so we've talked to the deans and collectively decided that there should be ways for students to continue to make progress even if they're not here in person. The way that manifests is going to be very different. In some cases, some courses may be given in mixed modality with faculty teaching both simultaneously in person and online through streaming videos. In some cases, a course might be broken up into sections where there's an in-person component and an online component. In some cases, it may be that the in-person component is so important that substitutions need to be made. And all of that is certainly being developed at the department level.
Thanks, Stephen. Jon, a phase 2 question for you. Is it possible that phase 2 will include changes to travel policies for the faculty?
The answer is yes. To remind everyone right now, under the aegis of the university, domestic and international travel actually can be done. It has to be deemed essential by the department and the school. So it's not a decision we make on a case-by-case basis centrally. So essential travel can occur now. Of course, individual personal travel, we have no purview over that at all to begin with. We're discouraging it as a recommendation, but have no purview over that.
Thanks, Jon. Stephen, by when do we anticipate a final decision will be made about whether spring courses will be taught or offered in person?
So we have talked about as a target, having students being able to register before Thanksgiving. And in order to make that deadline, certainly decisions and announcements need to be made several weeks before that. So I would say at latest before Thanksgiving, but we're frankly aiming for the next several weeks when we can lay out the contours of our plan and communicate that so that faculty, students can start with planning for spring.
Thanks, Stephen. Jon, question about vaccines. If vaccines are available this spring, how will we treat that for students that are on campus?
So obviously none of us know when one or more vaccines will be widely available. What we're doing right now is working with the health system in an approach that mirrors what we did in 2009 with H1N1, in which we pooled vaccine resources when they were scarce at the beginning between the university and health system, and had a single common integrated prioritization approach to who got vaccines that were owned or held by Hopkins, starting with the highest priority group as identified by CDC. It might be healthcare workers in this case, as an example, and then depending on different pre-existing conditions and so on in our students, staff, and faculty. And so it's very likely we'll use a similar approach this time. Obviously, once vaccine supply readily opens up, we won't need a prioritization scheme. I'm going to, this is just Jon Links talking, I'm going to predict that we would not make a COVID vaccination mandatory, if we ever did, until we were both convinced of its safety and efficacy and its wide availability. In my mind, wide availability and spring don't go together. I don't think we're going to have a widely available vaccine when we enter the spring semester. Later down the road, things may change.
Thanks, Jon. I see we're closing in on 2 p.m., but I am going to try to get to another question or two. So Jon, for you, what restrictions do, if any, do we have on the quality of masks, since we know that they vary in level of protection?
Yeah, it's a great question, and we've of course struggled with this. The two things that we've prohibited are masks that have exhalation valves, because then you're not protecting anyone else, and neck gaiters. And that was based on some literature around sort of the average type of material that a neck gaiter is made out of compared to a cloth face covering. Now, we all know that cloth face coverings come in a variety of the styles in terms of the number of layers, the type of material, and so on. We have not taken the extra step of trying to prohibit certain types of cloth face coverings that, frankly, just gets too complicated. And we think that any of the face coverings are doing enough of the job we're expecting them to do, because we're not putting all our eggs in the masking basket, right? It's the ensemble of control measures that is that we're using to get us to where we need to be.
Thanks, Jon. And we're just shy of 2 p.m., so I'm going to wrap up. I want to close out this town hall by thanking all of you, the faculty, for joining us this afternoon, and of course, for your continued efforts during these disrupted times. And while I know that we weren't able to answer every question that we received this afternoon, I do hope that this session has provided further clarity about our planning for spring 2021. The session has been recorded, and it will be made available as has been done with previous events. And next week, on October 21st, from 10 a.m. to 11 a.m., there will be a town hall that focuses on finances. With that, thank you and stay safe.